Okay, so we're going to begin our final assessment. I'm just going to kind of scan up and down around the room. There's my dog. There's the TV where you're going to be. This is just a chair and fireplace. I hope you can see everything. I don't know if I'm getting the floor. I'm sorry for making you dizzy. My husband. So I'm going to keep you over here so you can see the entryways and that nobody's coming in. And we'll go ahead and get started. So, alright, Mr. Gray, I'm going to start by looking at your skin. So I'm just going to look at your upper extremities. Color's pink. You're warm bilaterally. Hair is equal. Okay. And I'm just actually, while I'm up here, I'm going to look at your nail beds are pink. You've got 2-second capillary refill. And if you could just can you hold your fingers like this for me so I could just look for clubbing the nails together just like that? Okay. Okay, no clubbing noted. Alright, good. So I'm going to look at your lower extremities. Again, no lesions. Pink. I don't see any varicose veins at all. And I'm just checking for edema. There's none present. Okay. And the hair is also equal bilaterally. Alright, so I'm going to move on to your head. If you could just sit down for me. Can you sit down? You're a little too tall for me. Okay, so I'm just going to look at your head. Your head is normal shape, not too large. Hair distribution is regular. This is actually a gray forehead line. That's not hair. Not losing your hair. Hair is fine. I'm just looking at your scalp. I'm just going to peek at your scalp here. I don't see any kind of lesions or any dryness. It looks normal. I'm just going to palpate your head and your face. I don't feel any masses or anything unusual. So we're going to go ahead and move on to your eyes. So eyebrows are equal bilaterally. Your eyes are equal bilaterally. Okay, I'm going to get my light here. So what I would do is have you perform a Snellen test, which is where you stand 20 feet away from the card on the wall and you cover one eye and you read down to the lowest line you can. That's a Snellen test. Or the test for nearsightedness would be Rosenbaum, where it's the same principle. You hold one about 12 to 14 inches away from your face, cover one eye, and read the lines that way. Obviously, we don't have that here at our house. So I'm going to, my pen like that. Oh, here it is. Okay. So I'm just going to, can you look at me, please? I'm just going to look at your corneas. They're both transparent. I'm going to do the corneal reflex. Okay, good. And then can you cover one eye for me and look at my nose? And I'm going to have you pull that away, but keep looking at my nose really fast. You got to open your other eye. Just look at my, okay, good. So people stayed both equal on my nose, no deviance at all. Okay, so I'm going to move on to your ears. I know I'm forgetting a lot of stuff here. So I'm just going to look at, this is going to be hard to see, so I'm just going to kind of turn you this way a little bit. So I'm just looking at the exterior of your ears, meatus and the mastoid. Meatus. Okay, I'm looking back, I'm looking down into your canal. I don't see any redness or swelling or masses of any kind. Just hold nice and still for me, okay? I'm going to look down into your canal, look at your tympanic membrane. Tympanic membrane is a gray, translucent, and I don't note any scarring. Sorry, that didn't hurt, did it? Okay. So now I'm going to move on to your nose. I'm just going to use my light because it's so dark in here. Sorry, I won't shine it in your eyes. So, nose is equal. Septum is actually deviated slightly to the left. Looks like you had a broken nose at one point. Okay, so keep your mouth closed and blow out for me. Okay, and do this side. Okay, so it's Peyton. And then I'm going to do, keep your eyes closed. I'm going to do a little smell test on you. Okay, smell, sniff. Sniff this. Can you tell me what you're smelling?
Like sweet.
What are you smelling?
Soap.
Okay, thank you. Alright, so now we're going to move on to your mouth. Let me get my little, since my pen light's dying, I'm going to use this. Alright, so lips are equal. Can I see your teeth, please? Okay, teeth look good. Open. Open. Gums are good. Stick your tongue out. Tongue looks smooth and pink. Okay, and then can you say ah for me? Okay, and the uvula is midline. Alright, and then we're going to move on to your neck. So, I'm going to just look at your neck here. Everything looks symmetrical and equal. Sorry. Alright, so I'm going to actually palpate your cervical spine here. Okay, good. Now I'm going to check range of motion. So can you tuck your chin to your chest? Okay, and then head up, back, all the way. Good. And then check your ears to your, yep, and then to the other side. Okay, you can you open your eyes? Okay, and then let's see. Oh my goodness. This is a lot to remember. Okay, I'm going to palpate your trachea. So the trachea is midline and symmetrical. Okay. And then I'm going to, I'm going to do your nose now. So I'm going to palpate pre-auricle nodes and post-auricle nodes, and then occipital nodes, and then mandibular. Okay, so, and then I'm going to come down here and do the anterior deep nodes, and then the posterior cervical nodes. I don't notice any swelling or masses of any kind. Okay, and then I'm going to palpate your thyroid. So I'm going to do it from the front, anteriorly. So I'm going to use my thumb and deviate your trachea a little bit. Can you swallow for me? Okay, and I did feel that side of the thyroid, so I'm going to go ahead and do this. Okay, it feels flat. Alright, good. Okay, so your carotid arteries, that's one thing I need to do. So I'm actually going to have you turn towards me just slightly so I can palpate your, okay, and that's a 2, and then this way, and that's a 2, and then I'm just going to listen to your carotids. Can you turn away from me just a little bit that way? Okay, and hold your breath just for a second. Okay, no bruits noted. Alright, no bruits noted there. Okay, so we're going to then move on to the lungs. So if you can stand up and take off your shirt for me. It's okay. Okay, so first I'm going to do is just kind of inspect you overall. I don't see any masses, I don't see any lesions of any kind. Looks like respiratory effort is normal. So, and I'm going to inspect your posterior as well. Again, respiratory effort's normal, pink undertone skin, no lesions or masses noted. So take a deep breath for me in. Just gonna, okay, good. And I'm just going to palpate your chest here for any masses or lesions. Everything feels in normal limits. And then just turn all the way around. I'm going to do the same thing here. Okay, nothing noted there. Okay, so can you say 99 for me?
99, 99, 99, 99,
Okay, I don't notice any vibration here.
99.
Okay, that's good. All right, so I'm going to, actually I'm going to percuss you first. I'm going to just percuss your posterior. So I'm going to be tapping on you quite a bit here. All right. And I'm just going to take a listen to you. Nope, yeah, just back here first. All right, deep breath. I'm just going to kind of move through the spot, so just keep breathing for me. I'm sorry, we should turn a little bit. Just turn a little bit. Okay, so I did the top, so we're going to go here. Okay, good. I'm going to turn around. Let me do your anterior chest. Deep breath. Deep breath. Okay, so lungs sound clear bilaterally. So let me go ahead and move on to the cardiovascular system. So I'm just going to kind of inspect your chest for any heaves. And I'm just going to kind of palpate for any thrills around your heart area. The point of mass impulse is here. Okay. I'm going to listen to your heart sounds. So I'm listening to your aortic valve, pulmonic valve, Herv's point, tricuspid valve, and your mitral valve. No bruits noted. Okay. Then I'm going to check your pulses. So I'm going to check your temporal pulse. This side. Okay. I'll do your brachial pulse. Your radial pulse. Brachial. Radial. Okay. And then can you just turn around for a second? I don't know if you, yeah, you can see this. Okay, so I'm getting both popliteal pulses. Okay, and then turn around again. And I'm going to check posttibial, dorsalis pedis. They're all 2s, by the way. So far, everything's normal. Okay. I think that was it for the cardiovascular, because we already checked edema and we already checked cap refill. So, okay, so we're going to move on to your abdomen. I'm going to have you lay down on the floor, so we're going to have to move this around, which now is probably a good time for you to kind of look around and see that nothing has changed in the room. And that's back to where the dog is, and up there,
Sure.
and the chair. Okay, and that's where I'm going to put you, in this chair back here. Okay, if you just lay down. This is going to be kind of difficult. Maybe
Fireplace.
yeah, I'm going to move you to the fireplace, so that way I can get on that side. I think that's good right there. And we're at, can you push forward just a little bit, honey? We're at 17 minutes, so we're moving on good. Okay, so first thing I'm going to do is just inspect the abdomen. So umbilicus is midline. I don't note any lesions. Skin color is pink. No bulging or masses noted. So next thing I'm going to do is auscultate. Alright, so we're going to start here. You got good bowel sounds. Okay, so now I'm going to percuss. So you're just going to feel me tapping on you a little bit. Sorry. Just let me know if anything hurts. Does that hurt? Okay. Alright, now I'm going to palpate and measure your liver. So we're going to start at the umbilicus and work up. Okay, that's where I notice the dullness right there. Start here and work my way down. I'm going to do that again. Over here. Okay, so I'm going to measure that. So we are at 9, and that's 7, which are both within normal limits. So then I'm going to come over here and palpate the spleen. Here. Does that hurt you? Okay, I'm sorry. I'd have to have that looked at. Alright, and I'm just going to palpate your liver here. Raise you up. Take a deep breath in and hold it. Okay, and I can just barely feel the bottom of the liver. So we're going to come over here and gently do the spleen, since there were some complaints during percussion. I'm not really feeling the spleen. Okay, and I'm going to palpate your kidney as well. So I'm just going to lift up your flank here. Okay, I think I feel just the top of the kidney there. And then you know what I didn't do? Darn it, I didn't listen to your... Well, I can still do vascular sounds because I'm not worried about... I'm going to go back and do the vascular sounds. So I'm just listening to the aorta. Just going to go down the major arteries here. Okay, no bruits are noted. Okay, so now I'm going to move on. Let's see, we did abdomen, cardiovascular, we did, okay, so now we're going to get up and we're going to do musculoskeletal. Alright, so I'm going to move this back. I'm going to move this back up here, just kind of panning around so you can, I don't know if you can really see them. I'm going to put you back up on the TV here. So, alright, so I'm just going to look at all your joints, just kind of inspect. So I'm looking at your fingers, I'm looking at your wrists, your elbows, your shoulders, your cervical spine, hips, knees, ankles, feet, and toes. Everything looks symmetrical. I'm just going to look at your spine this way, your thoracic spine, your lumbar spine. Everything looks equal. Okay, so since you're turned around, I'm just going to palpate your cervical spine. And this is not a back rub. Okay. Thoracic and lumbar, everything looks equal bilaterally. No masses noted. So I'm just going to palpate fingers, hands, wrists. I don't feel any nodules or anything. Elbow, shoulder. Okay, just gonna feel your hips here. All right, and knees, ankles, feet. I don't feel any nodules. I don't notice any type of arthritis symptoms. Okay, so if you could take a seat for me on the couch, I'm just going to look at your head. Head is symmetrical, normal shape. Okay. I want to do range of motion. That's what I want to do. So go ahead and do I'm going to do your cervical neck. So tuck your chin down again, back all the way, and ear to the right, ear to the left. And then I want you to actually rotate your head. Like, no, look at me, like this. Okay, good. So everything looks good there. And then can you push against my cheek? Push against my, okay, and then go out this way. No, turn your head this way, like that. There you go. Okay. All right, so we're going to do, I need you to stand up for me, because, okay, so I'm going to check your shoulder range of motion. So if you can, bring your arms up this way, and then all the way back, and then internal rotation like this, then external rotation. Okay, that looks equal and good. So can you, okay, bring your arms down. Can you flex a muscle for me? Okay, and then hold it against my resistance. Okay, good. Now extend your arm out like this. Okay, and then try to press up to, okay, good. And then elbow out, just like this. Yep. No, bring them so I can see the range of motion. And then can you, okay. And then we won't do the shoulder, the strength, because that's the same for the shoulder. So wrist range of motion, and okay, and then fan your fingers out and in. Okay, and then bend at these joints here. Okay, good. And then bend here. Okay, make fist, and then touch thumb to fingers. Okay, good. And then try to flex your wrist down against my resistance. Okay. Now flex it, and I'm going to pull back up and try to, no. Flex it and try to hold it there while I pull back up. Okay. And then fan your fingers out and hold against my resistance. I'm going to try to push them in. Okay, now the opposite. Hold them closed. Try to push out against my, okay, good. All right, so then we need to go onto the floor again because I need to do your hips. Actually, before I do that, let's do your spine. So I'm going to have you just kind of lean back. No, lean back towards me. Like kind of hyperextend. Okay, good. And then go ahead, and I'm going to kind of hold you and lean down and reach to touch your toes. Okay, and the spine looks equal. I don't see any signs of scoliosis or anything. It's nice and symmetrical in the middle. All right, so let's do your hips. I know I've left 100 things out, but this is really a lot to remember. Okay, so come on down onto the floor. Okay, so what I'm going to have you do is first raise your leg off the floor. Okay, good. Put it down. Other leg. Okay, good. And then cross your ankle over one of your knees. No, up like this. Bend at the knee. Cross, yeah, like that. And then push that knee down to the ground. Okay, good. And then do the same thing on the other side. Just want to make sure that you get this good. Yeah. Okay, so lift this leg up against my resistance. Okay, good. Can you press your knees together? Okay, and then how about outwards? Good. Okay, and then just turn over onto your belly for me. Okay, and then just raise your leg up off the ground. Okay, good. And then this side. All right, good. Go ahead and turn back over. You can actually get up off the floor now. I'm going to have you sit up on that side where it's a little higher because you're so tall. I'll just leave that right there for now. And then let me just see you cross your legs both ways. Yeah, I just want to check your hips that way. Okay, looks good. And then knees, can you put your knees in and out for me just so I can see the range of motion? Okay, and the other side. Everything looks equal and normal. Okay, so keep your leg flexed in, keep your knee flexed in, and I'm going to try to pull you out against resistance here. Okay, good. And then extend your leg. Okay, and then try to pull back into a flexion. Good. Okay, and then ankles. I think you can see this. Okay, ankles, just dorsiflex up, right, turn your face, and then plantar flex, and then rotate this way and out. Okay, good. And then pull up towards your face, push down, inward, nope, against me, inward, good, outward, good. Okay, let's see, we need to do your reflexes. I did all your joints. Okay, I'm going to use this thing to do your reflexes, and I think I'm going to move it back again. I'm sorry, I hope you can see this well. Okay, so I'm going to check your bicep reflex. Okay, and I'm going to do your tricep reflex. I'm going to hold your arm up like this. Okay, and then I'm going to do here. Okay, I'll move there. And then I'm going to do, well, I guess I'll do bilaterally. I think I'm supposed to. No. Hold your arm. Okay. Okay. And then alright, and then back up a little bit just so your feet aren't completely out. I'm going to just do your knees here. Your patellar reflexes. On this side. Okay, and then we have your foot here. Okay, and then this side. Okay, so all your reflexes. I know I left out a lot of stuff, but I think I got most of it. Alright, thank you. Okay, thanks for all your support this semester. We really appreciate it, and I'll send you an email.